So here's a laundry list. You can do a screenshot of this where you have the general laundry list of things that exercise benefits is a list of 20: reduce body fat, increase lifespan, oxygenates the body, strengthens muscles, manages chronic pain, wards off fires, reduces diabetes, strengthens the heart, clears arteries, boosts mood, maintains mobility, improves memory, improves coordination, and strengthens bones, improves complexion, detoxifies the body. There's a detox effect with exercise. We've seen that before. Decreases stress, boosts the immune system, lowers blood pressure, and reduces cancer risk. So there you have it. Now, what I want to do is I want us to take a short break, and I want to come back and give you my perspective on this, because we actually have been using exercise in an informal way in my practice, and we're starting a new program that I'll talk to you about briefly tonight, but we will talk about a lot more in the coming weeks. So why don't we sit tight, and I'll wrap it up with my perspective and some recommendations, things in which you can do if you want to start, today or tomorrow. Okay, we're back for the next segment. Now, a couple of questions here I wanted to touch on. First, blind guidance, why we always hit the button first. Thank you very much for being the leaders in that area. There's Kathleen Anderson, greetings from Massachusetts. So good afternoon, Dr. Montgomery. How often should one exercise with osteoarthritis? The study, they recommend at least 3 times a week. I think if you have osteoarthritis, and it depends on, where it's a weight bearing joint or not, I would start with 3 days a week. I would start with things like flexibility. You can do lunges, you can, climb hills and things, but you want to work muscles around that joint, not necessarily the affected joint. But you start with 3 days a week and work your way up from there. At least 3 days a week, 30 minutes a day, and then build up from there, and then go to 45 minutes, 3 days a week, and then go 4 or 5 days a week from there. How do you reduce inflammation? I'm going to address that, Ms. Anderson-Williams, in just a minute, because I think that's a very important question. Can resistance training increase the size of left ventricular hypertrophy? Will it be harmful? That's a great question. The answer is, the cause of left ventricular hypertrophy is multifactorial in many cases, and is related to a lot of biochemical effects. My answer is, generally speaking, no. Now, if someone has uncontrolled high blood pressure and you're lifting weights, deadlifting weights, and you're not doing anything to address the blood pressure, then that kind of resistance training to an extreme level can worsen blood pressure and therefore contribute to left ventricular hypertrophy. But strength training in general does not. I'm going to explain why in just a minute as I go through these questions. Good evening. What do you think about bike riding if you suffer from hypertension AFib? I think bike riding is an excellent way to exercise. And blind guidance, why for taking it off. Y'all have a good evening. Thanks for joining us tonight. Let's see, Chris Smith. This is great information. What is the best test to determine your cardiovascular endurance, health, heart rate zone for fat burning, anaerobic threshold? Oh my goodness, that's a very complex question. I'm not going to answer that in details beyond the scope, but here's some simple things you can do. The simple thing you can do is start with your resting heart rate. That's a very simple test that everyone can do because, testing metabolic threshold, you need, VO2, anaerobic threshold, you need special equipment for that. But a simple resting heart rate goes a long way. Now, a lot of things affects heart rate, but let's say you have a normal rhythm, don't have atrial fibrillation or anything like that, then some of the major contributing factors to heart rate is going to be volume status. So if you dehydrate, it's going to be high, but also your conditioning level. So things like your endurance and health, you want to look at heart rate. Now, where should the heart rate be? I like people's heart rates in the 60s, ideally, resting heart rate in the 60s. And, it doesn't go up by more than, 20% with light, moderate exercise or something like that. If you have a heart rate in the 50s, assuming you're not on any medication like beta blockers or anything else that can slow your heart rate, or if you don't have thyroid dysfunction, etc., then and it's reduced to working out, that's related to high vagal tone, and you probably have a very good, endurance level. So resting heart rate is a simple test that everyone can look at. And if you start with resting heart rate in the 80s and you start working out, and then you notice the heart rate comes down to the 70s resting, then you know that that's beneficial. Another thing you can do is you can look at heart rate recovery. So let's say, for instance, you have a simple step test. So you have many people buy these little step devices from the gym, excuse me, and you can do a step test. So let's say you do a step test for 30 seconds or a step test for 60 seconds. Measure your baseline heart rate, and then you do the step test, and immediately check a peak heart rate immediately at the end of the step test, and then see how long it takes your heart rate to get down to the baseline heart rate. So let's say your baseline is 70 beats a minute. You do the step test, and it gets up to, say, 120 beats a minute, 130 beats a minute, during the step test of 60 seconds. And then at the end, it comes from a peak of 130 down to 70. And let's say on day one, it takes 5 minutes to get back down to the baseline. Then you are working out, improving your condition. So then your new baseline heart rate is 60 beats a minute because you've been working out, let's say, a month. You do the step test again. Instead of going to 130, it goes to 120. And then at the peak exercise of 60 seconds, then when you come down after it, when you recover, that heart rate, instead of taking 5 minutes to get back to baseline, it takes 90 seconds, or let's say 60 seconds, 1 minute to get back to baseline of 60. So that shows you that you had an improvement of your endurance and cardiovascular fitness, and there's some improvements of anaerobic threshold. Now, again, those are specific measurements that you have to make using equipment. Fat burning zone depends on your baseline metabolic condition. And so that's some other calculation you need. But I think heart rate is a very good way to get to that. Hello from New Jersey. Thank you for sharing your work. And thank you, Alicia Martin, for joining us tonight. It's take care of yourself. Actually, I'm only doing the rebounding regularly. Oh, rebounding is great. Rebounding is good for lymphatic drainage. Later, flying abound on. And what about low thyroid? What do you do? There are a lot of things that contribute to low thyroid function. And so it depends on why the thyroid function is low. We have a lot of people with low thyroid function because there may be increased autoimmune disease. Maybe, you had your thyroid removed, you have to be on supplements. So that's a different story if somebody has this low thyroid disease due to metabolic conditions. We've had a number of people with low thyroid condition, low thyroid function, and just by improving their body's physiology and nutrition, thyroid function improve. Improve glutathione levels. There are different things you can do sometimes with supplements, iodine levels and things can be checked. Make sure there are no antibodies that are suppressing the thyroid. So there's some metabolic things you want to do as well. Does hyperthyroidism increase your resting heart rate? Hyperthyroidism does increase your resting heart rate. So that's something you want to look at or have your doctor measure thyroid function in the setting if you have an increased heart rate. Anemia can increase heart rate, infection. Volume depletion is one of the most common things that we see. Many people are just dehydrated for lots of reasons. We don't drink a lot of water. We don't eat a lot of hydrating foods. And we consume dehydrating beverages and foods as well. So how can I find out the reason why your thyroid is overactive? There are a lot of things you can do. You have to see an endocrinologist for the most part. What we do is we check antibodies. We check thyroxidase enzyme. We check anti-thyroid hormones, antibodies. And oftentimes we see those antibodies to be elevated. And so you may have just an acute inflammatory reaction, we put our patient on detox to just kind of decrease inflammation, and oftentimes that helps a lot. So what is my take on this? I mean, obviously the data is pretty clear, and I don't think I had to do this talk for you guys to understand that exercise is beneficial in general. I mean, the laundry list, the 20 things I shared with you are pretty much many things we know, a lot of it through our personal experience, through experience of other people that we know. So what is the deal with exercise? Exercise is beneficial. However, I often emphasize that nutrition is really important with exercise. So you see all of these conditions that we talked about, they all have metabolic components that are key players in terms of their condition. So inflammation, for instance, in terms of osteoarthritis and hypertension and coronary disease and peripheral vascular disease, all these things are metabolic conditions. Inflammation plays a key role in them. Increased oxidative stress plays a key role in these things. Increased oxidative stress and increased toxic molecules that need to be neutralized with antioxidants. So how do you do that? Well, nutrition is going to be one central way, and I push a plant-based diet. So in our practice, what we do, and we start nutritional detox with raw plant-based foods because that hydrates the body very well. It detoxes by neutralizing free radicals very well. It reduces inflammation very well, and these are all scientifically validated things that we've shown in our studies and other people have shown in similar in the medical literature. So when you start off with a nutritional detox, you cleanse the body, cleanse the system. So let's say someone has osteoarthritis, got lots of inflammation in the knee. When you detox, inflammation goes down, the knees feels better, and mobility improves. Back pain, similarly, inflammation goes down, mobility is better, exercise improves. Mental disorders, actually, these endorphin levels are increased, and so your mood goes up. So your desire to exercise increases. People have increased weight loss is improved drastically, so your mobility improves. So optimal nutrition really we use as a precursor to exercise. So we may put someone on a detox regimen for 1 week. The first week, they may either do light or no exercise, and after that first week, they start to exercise, and we increase the intensity over time. So what we have done is created a program called Heart and Soul of a Champion. You're going to hear more about this program down the road. It's going to be a docu-series released about this program. You guys are the first in the general public to hear about it. I couldn't hold back, and we'll be releasing the details later. But the Heart and Soul of a Champion is our integrated care. It's a documentation of our integrated care program. We use multiple modalities, nutrition being the core, exercise, fitness, sauna therapy, bema therapy, the other therapies. We use targeted supplementation to reduce inflammation, to reduce oxidative stress, improve circulation, and reduce inflammation. So this is going to be the core of getting the body working. And we have individuals, and we have our workouts are primarily outdoors. We have some outdoor facilities that we use, and we use in groups. And so people will sign up as groups, and you'll be able to be part of this. So stay tuned. I'll bring you lots of information about Heart and Soul of the Champion. That's going to be coming near you. We're going to have a major open house in October, and the first season of the docu-series of Heart and Soul will be released the latter part of this year. We'll have some pre-release information coming to you within a month. So stay tuned and help pass the word. We'll have more information on future shows on Fresh Natural Live. And you want to stay on top of that, because I've learned and based on the science that we use and clinical experience that we need to be much more intentional with exercise. We've had individuals who are in their 80s and 90s with severe heart conditions, severe inflammatory condition, by just detoxing their bodies, adding exercise, adding things like sauna, target supplementation in certain ways. This aggressive, intense approach we're using has helped individuals turned around drastically. And we're going to continue to push the envelope using some of the basic approaches. So stay tuned. So let me see if there are any other questions. Alicia Martinez, let's see, my endocrinologist for my mother did blood work, wanting the specific tests, the requests, etc. For thyroid function, You want to look at TSH and the thyroid panel. Do you have a cure for tinnitus? That's a good question. I don't like to use the word cure because I think the body heals itself. Tinnitus is an inflammatory condition that affects the middle ear, and so you have this ringing in the ear. I have never detoxed anyone with tinnitus, and we typically send them off to a ear, nose, and throat person. I suspect that if your typical medications don't work, a detox regimen could, but we've never actually tried that on someone with tinnitus. The diagnosis of congestive heart failure, should one consider rebounder to clear the lymphatic system? Rebounding helps, I think, in all conditions. I think it will help in congestive heart failure as well. You want to do that in the context of doctor supervision, but I think, yes, rebounding is a great exercise for congestive heart failure, among other exercises. So keep in mind, heart and soul of a champion. You will hear more about that soon. I thank each and every one of you for joining us tonight on this Labor Day. And I look forward to seeing you next week when we talk more about some interesting topic. Until then, keep it fresh, natural, and live.